Welcome to Utah Stories. We are joining you live from Holiday, Utah. My name's Rich Markosian. I'm the editor and publisher of Utah Stories. This is our latest issue of Utah Stories magazine. It is an awesome issue full of ladies who are doing awesome things, and we also have beer innovators and really cool things that are happening in the local sphere of Utah. And that's kind of what we do here. We like to report on the voice of local Utah. We like to provide a voice to the voiceless. We want to go out on the streets, interview people, present their voices to you, and present their voices to the people who are making a lot of the decisions on their behalf. And we also like to have on this program people who have differing views and points of views and help bridge divides between political parties and factions. Just a little bit of background on me and what we're doing. I'm half my family's Mormon, half my family's not Mormon. A lot of my family are liberals, a lot of my family are conservatives. So I'm kind of a middle of the road type of guy. I'm definitely small government, more liberty minded than big government and intrusion. But we're all about finding the truth, seeking the truth, and reporting the truth. So if you like that mission, go out to utahstories.com, subscribe to our free digital newsletter, and we will send you the voice of local Utah once a week right to your inbox, or subscribe to our print magazine for just $3 a month. And that supports our team of intrepid local journalists, and it helps support this podcast and our upcoming docuseries on Main Street. I'm going to be telling you more about that in coming episodes. So also hit the like button, subscribe to the channel, follow us on Instagram. We're now on Twitter, a little more active. But thanks for watching. So today on the program, we've got a guest coming on. It's Dr. Mark Cannon, and he's going to be talking about childhood obesity. I'm so glad that we found somebody who can talk about this. We actually have a really serious problem here in Utah that he's going to report on. We're getting 66% of kids are drinking sugary beverages every single day, and that's their main source of hydration. And 52% are not receiving a daily, not even a single daily dose of vegetables. So he's going to be coming on in the program in about 15 minutes. But before he gets on, I want to talk about a few things. I want to summarize our homeless coverage over the past 3 months. A lot of you have maybe tuned in and watched here and there, but I wanted to provide a summary because I think I've finally come to some major conclusions regarding why homeless policy is so flawed, not only here in Utah, but all over the United States, why cities are deteriorating at such a rapid pace, why the homeless are not receiving the kind of care that they actually need. And really, I think I found the answer by mostly talking to the homeless, but on the program a couple of weeks ago, we had Paul Webster, and he's a homeless policy expert. He worked under Ben Carson in the Housing and Urban Development Department under Donald Trump. And what he said to me was really shocking about why Housing First is such a failure, why permanent supportive housing is proving to be so terrible for not only the people inside of it, but the neighborhoods around these facilities. We know there's drug trafficking going on around these facilities. There's sex trafficking going on. If you know the neighborhood that the Magnolia Apartments are in, it was once a great neighborhood, one of the best neighborhoods in downtown Salt Lake City. It's really deteriorated, as has the Ballpark neighborhood, where you have the Gail Miller Resource Center, as has the neighborhood around State Street, where they put another women's homeless resource center. And my big question is why? What is happening? Why is everything appearing to fall apart with these programs? And the problem is that if you are at the bottom and you really want to get the most amount of care, you need to become labeled disabled. If you have a disability, your chances of getting permanent supportive housing and moving to the top of the line under a point system are so much better than if you don't have a disability. So how do you get a disability? The way you do it is by being chronically homeless, By being chronically homeless and or drug addicted for 3 years, you can be labeled disabled. And your disorder moves from the disorder category, which might be preventable, you might be able to get over it, to a disability where you essentially absolve yourself of any responsibility for that disability because it's beyond your control. You can say, I have this genetic problem that makes me predisposed, which is sometimes true, of course, to this disability, but it's making chronic homelessness really an attractive lifestyle choice. I mean, you really can't look at it beyond that. And it's shocking to see that that is really what you find when you go down the deepest, darkest rabbit hole concerning chronic homelessness and why it is increasing so quickly in this country. I mean, just imagine your name is Peter and you have a friend named Paul. And say you and Paul were painters and you were working hard, and then you fell on tough times. You have some medical bills you're trying to pay off. And Peter and Paul says, you know what? I just have all these medical bills I've been trying to pay off and student debt and all this crap I can't pay off. But I just found out that I can get my alcoholism labeled as a disability, and I can get on Social Security disability, and then I never have to work again. I can get a check from the government. I can get potentially into permanent supportive housing, and I don't have to pay off all this crap because I have a disability. And I don't know that it's happening exactly like that, but I've talked to people on the streets who told me that their caseworker tells them, don't worry about getting a job. That kind of messes up your chances of being qualified for Social Security disability. Just stay out on the streets, use drugs if you have to, self-medicate, and you'll be lucky because you can go to the top of the line. You can have the most points awarded to you to get into your permanent supportive housing unit. And it's an absolutely insane system. Absolutely insane. That is the model that Housing and Urban Development, the federal government, has placed before us and says we have to follow that model in order to get their money for our permanent supportive housing units. And as Paul Webster said, it's only about, I believe he said $13 million. So compared to the overall $300 million that we're spending on homelessness in Utah, it's a small drop in the bucket. And we just need to get ourselves off of this federal money and realize people perform when you set bars for them. When you say, look, I know you're going through addiction. I know it's very hard, but let's set this bar really low and see if you can work 10 hours a week. Then if you do, you can get more money set aside for savings, not punished for working hard. Then set the bar a little higher, and then maybe you can get in a better apartment. There shouldn't be two ladders. There should be one ladder, and it should only be going up. The way we've got it right now, there's two ladders. The government ladder is only going down, and they're only rewarding you the further and further you go down. And it doesn't make sense because that ladder is conflicting with the free market ladder, which people, of course, in this great country of America, why everybody wants to migrate here, is because we have a true meritocracy where the harder you work, the better off you can end up as long as you abide by the rules, you work hard, you play fair. It's just a system where, I've heard restaurant owners saying to me, like, I'm glad we have an open border. We need the workers. We can't hire enough people. Why can't these open border people just come right into my restaurant and work for me? And I said, well, what about the homeless? Why can't we employ the homeless? And a lot of them say, oh, they don't want to work. Most of them don't want to work. They don't want to take jobs. But the truth is about half of them do. I did a survey. I wrote a story about it. About half of the homeless people actually would like to get off the streets, would like to work, but they're either being told they shouldn't take jobs because they'll get more benefits if they don't, or they're learning about how to work the system. And you work the system by remaining chronically homeless and being labeled disabled. That is like your key to getting off the streets, being labeled disabled. And so we had Rocky Anderson on the program last week. He talked about homeless atrocities, abatements, the confiscate and harass policies that are currently in place in Salt Lake City. It's absolutely awful what so many homeless people are going through. He wants to reverse that by being elected mayor. And we have an investigation we're working on about the misappropriation of affordable housing money to a developer. We are really diligently working on this story. You're going to want to read it. Very soon, we will have a brand new website with a paywall for members. And everybody who subscribes to the magazine, in the first 3 months, we're going to make it members. And then the membership's going to go up to $5 a month. And that's going to go to funding our docuseries. And so I encourage you to support that if that sounds interesting to you. So why should we care? That was another issue. Why should we care about homeless people, drug addicts? Like, if people are on a path of self-destruction, why not just let them self-destroy and die? We had these deaths last winter. I think a lot of people, we get the comments in YouTube like, okay, let them die, you know? And here's why I think you should care. 100,000 people in the United States died last year due to drug overdoses. Many of them were from this fentanyl being produced by Mexican drug cartels. So why should we care about that? Because you could say, this doesn't affect me. I've got my job. My kids are okay. Everything's fine. No, if this continues, more and more kids, more and more adults, more and more people are going to think they're taking a medication that's going to help them, and they're going to take a dose of fentanyl, and they're going to die. And this is happening more and more frequently. And not only that, homeless people are essentially, as is written in the New Testament, I quoted the book of Luke, they're lost sheep. And I think whether you're a Christian or you're not, a lot of people call themselves Christian, but they don't see it as a part of their mission and their personal value system to help lost sheep. And these people don't really need more food. They don't need so many blankets. What they really need is more compassion. They need more people listening to them. They need really case workers who care about them a little bit. I think if there were a local jobs program for local restaurants, I really believe that would be a key to reintegrating these people into society. And you talk to homeless people and you realize these are not crazy criminal psycho people. These are just normal people who've had a run of bad luck. These are people who have basically, most of them come from bad family situations, like they've basically been ostracized by their family members, and they're trying to get back on their feet. And when you start to actually speak to them, you find out most of them, they just ended up in a place where they never thought they would end up. And I think that they deserve our compassion, and we need to stop basically treating them like human garbage. And that is exactly how they're being treated. The front end loader comes in, they get a notice, we're removing all your belongings in your tent from this area in 2 hours. So then the front end loader comes in, it puts it in a dump truck, and they need to scurry away. And if their stuff is left behind, you know, forget all your stuff, your driver's licenses, your medications, your wallets, whatever. It doesn't matter. We're throwing it all away. That's how we're treating the homeless in Utah. And it's completely inhumane. And Rocky Anderson talked about that. 3 weeks ago, Ty Bellamy talked about it. Ksenia from Nomad Alliance bought a $4,000 bus so that fewer of them would freeze to death. Not the best solution, but the government's really not doing anything except spending hundreds of millions of dollars on administrators. That's what I've tried to figure out. Where is all this money going? There's 300 homeless-related organizations in Utah. They all have great missions. They all have great values, but they're all staffed by administrators who often overlap in the job functions they perform. And they often, sit at a desk. They're performing a function, but the money's going to mostly the administrators and not to the homeless people. The majority of that $300 million we're spending is going to staff these places like Department of Workforce Services, the Community Action Network. And I'm not saying any of these places are bad. I'm not saying that. I'm just saying the majority of the money that's supposed to go for homeless services is going to administrators and instead of actually helping these people. And it amounts to, right now, about $85,000 per homeless person that we're paying out right now for every homeless person that's in Utah. And that includes all the people that are in permanent supportive housing. That bill is expected to increase at least double in the next 5 years if we continue to increase the number of homeless people at the rate we've been increasing in the last 4 years. That's why this topic is so interesting to me, and it's interesting that the mainstream media and the local media especially is really not covering it in depth. All right, so the other thing I wanted to talk about is I wanted to talk a little bit about Moab affordable housing. We're doing a new deep dive into that. We're talking to people who are promised jobs in Moab, saying, yeah, come here. We can pay you 50, 60, 70, even like 80 grand a year. And I can't say that. I need to back up. I know that some people are being paid $50,000 to $60,000 a year, and they end up in Moab, and they cannot find any housing at all. And they're ending up either camping or living out of RVs, even with these really high-paying jobs. And what it really comes down to is the NIMBYism in Moab is absolutely out of control. That city needs to grow to support a working-class community, and it's not growing at all in terms of providing actual affordable housing. We're really looking into that in depth in the next couple of months. We're going to have podcast guests, and it's just really kind of sad because I'm going to play an interview for you in the short future of a couple who both took jobs with the new Utah State campus down there. And they cannot find anywhere to live, and they have to move their RV around, and they're teachers at Utah State University, and it's unbelievable. And that's not just them. It's I've heard it's hospital workers, teachers in the public schools, cafeteria workers are almost impossible to find, and it's really kind of a real crisis. Like, that word is overused in terms of the housing crisis, but there especially is. And so that's going to be up and coming. And then the last thing I want to tell you is this gondola fight continues. Just yesterday, we went and attended a meeting at the Wasatch Front Regional Council. And what that is it's a group of people who are mayors from all the cities along the Wasatch Front and kind of stakeholders. And they get together and they decide what projects they should fund and what the direction of the growth of the Wasatch Front should be. And unbelievably, the only people there opposing this ridiculous gondola proposal are Salt Lake County Mayor Jenny Wilson, Salt Lake City Mayor Aaron Mendenhall, Sandy Mayor Monica Zielinski, and I believe Mill Creek Mayor. The rest of them are all for this extremely stupid gondola idea. Why is the gondola so stupid? It sounds cool. A gondola can just whisk you away right up Little Cottonwood. It's because there are certain places where concrete and steel don't belong. And if you're not experienced in going up Little and Big Cottonwood Canyons, they are the most majestic, amazing places you will ever go skiing. I mean, it is seriously. I went skiing last week. I hadn't been skiing in 5 years. I kind of just sort of wrote off the resorts, but it is so incredibly amazing to experience the powder, the vertical terrain from the top of the tram down to the base of Snowbird is something like 7,000 vertical feet. I might be getting that wrong. I think it's 3,000 to 4,000 vertical feet, but it's an amazing topography and geography, and to put more concrete and steel giant pillars, giant towers that would have to be 35 of them. Each tower would have a 40-foot base and just totally destroy that canyon and the integrity of the natural beauty is insane. I really can't look at it any other way. And I went there and I attempted to speak in the meeting, and I actually found myself getting really emotional. I couldn't really talk because I just have this sort of burning in my stomach that people could be that stupid to think this amazing natural beauty of this incredible terrain, these sheer granite cliff walls, that we should just totally molest that area with concrete and steel and these giant pillars and destroy it for everybody who isn't at the ski resorts out to their snowbird, because there's so much backcountry terrain in there. White pine, red pine, all the way up the canyon. You see more and more cars, people enjoying the backcountry. And they want to go in and destroy that for all the people who are not at the resorts. And so I don't know what else to say about it. We've had a lot of people on the program talking about it. We've had friends of Cottonwood Canyons on. We've had Carl Fisher from Save Our Canyons. The mayor of Alta, Utah was on the program, Roger Bork. And these young kids are coming up and saying how much they love the beauty. And it's unbelievable because it's only in the interest of greed, pure greed, that they would build this gondola, and it's actually moving forward. UTA now has something like $135 million to start on the parking lot for the gondola, and then it just looks like this ball is slowly moving forward, and you see this Wasatch Front Regional Council people just nodding their heads while they're listening to these people give these really eloquent remarks about why we should save this pristine beauty. They just kind of, yeah, that's cute. Yeah, that's fine. That's nice. And it just amazes me that Utah, we live in such an amazing geographical location that we can just be completely overrun by greed. And so, but on a lighter note,
there's a comment on this if you want to read it.
Oh yeah, let's hear it. Yeah, thanks all of you who are tuning in live. We're slowly going to be advertising that this show is live.
So we have a comment from MH, says, I like nature too, but leading with concrete doesn't belong isn't a strong argument against. Gondolas aren't concrete jungles. What are your thoughts?
Yeah, that's a good point. The gondola itself is not concrete, but the base of it would require several metric tons of concrete at the base. Like, you know what you find in that Gondola Works website is they never show the base of the gondola. They never show. It's a 40-foot diameter base, and each of those base towers will need to be on a pillar of concrete, and that will absolutely decimate the Wasatch Cache National Forest area in Little Cottonwood Canyon. And they just don't want to show you that. So I would recommend you go out and check out Friends of Little Cottonwood Canyon, because they've actually done a mock-up with the gondola piers and the concrete base, and you can get a much better idea of what that would look like. But I mean, you go up to the ski resorts, go look at the base of the tram, those giant towers that they had to put in place for the tram, and go stand next to one of those and tell me if you feel like you're having a really wonderful experience in nature when you watch that tram fly by and you're sitting next to a giant concrete pillar and a huge steel tower that are required to support that tram. I mean, I spend a lot of time in the backcountry, so I guess I'm biased, obviously. I go to Mill Creek backcountry. I go to the Uintas, and it's my favorite place to be. So obviously I'm a little bit spoiled and I'm a little bit biased, but I just think it would decimate the whole experience of being in the backcountry in all of Little Cottonwood Canyon if they did that. And in my opinion, of course. But thanks for your comment. I appreciate that. All right, so we're going to pause, and coming back, we are going to have on the program Dr. Mark Cannon, and he's going to talk about this new study by the CDC, and he's going to be talking about childhood nutrition and obesity, and really excited to have him on, and that will be in just a few moments. So stick with us. We'll be back soon. Welcome to Utah Stories. So, our guests on the program today are going to talk about childhood nutrition, obesity, oral care, and we're going to get into gut health. It's a really exciting conversation we are going to have. Thanks for joining me, Mark and Nate. I really appreciate it.
Well, thank you so much for having us.
Could you start with just a little bit of introduction? Introduce yourself and your background.
Well, I'm Mark Cannon. I'm a professor at the Feinberg School of Medicine in Chicago. It's part of Northwestern University. Feinberg is a very highly regarded, very well-known medical school. And I've been involved with pediatric dentistry and teaching at Children's Hospital in Chicago since 1978. I do a lot of research, but I do clinical care. And I'm currently the president of the American Academy for Oral and Systemic Health, which is a charity. We are on a mission to improve health, really specifically with children as much as possible, but all ages. And to do this, we have realized, like everyone else in healthcare, you have to start prenatal care, absolutely, and nutrition is essential. So our group, we include physicians, dentists, nurse practitioners, hygienists, nutritionists, psychologists, chiropractors, everyone who has some skin in the game, including the dermatologist, with health. And so I typically will be at meetings like I was at the recently at the Integrative Dermatology Symposium lecturing because nutrition affects everything. It affects your status if you do well with chemotherapy. It affects your results with all the treatments for oncology. If you don't have a good immune system, you don't do well. Mm-hmm. Numerous studies have been published in peer-reviewed top journals. Everyone now recognizes how important nutrition is with oncology, with cancer. But nutrition goes back to development of the child, development even of the face, of behavior, of intelligence. There are so many key times in your life, in your lifespan, where nutrition is essential. And that's one of the reasons we're here is because we have a meeting next week. It's called the Golden Spike Meeting, where we're encouraging physicians and dentists to get together and let's talk about these issues. And we have excellent speakers from like BYU and UVU, all local people, and talking about airway, nutrition, and what we can do for the health of all of our patients.
Yeah, and what I find is that in our current medical system today, a lot of parents go to the doctor and say, you know, my kid's got this behavioral problem. We got 3 kids, and they all kind of have behavioral problems to a degree. And what we find is that the pediatrician is very happy to prescribe a amphetamine to a child who's got a behavioral problem.
Yes.
And that amphetamine is a stimulant that basically just stimulates the brain and makes the kid feel a little bit better, I suppose, because that stimulation doesn't have to come from external sources, and that can address the malnutrition, I suppose, to a degree.
But there's something there's something huge that you just mentioned, and let's talk about ADD, ADHD. Are you aware that they have published in all the top psychiatry journals? Not all of them. Let's say some of the top ones. That most of the kids diagnosed with ADD, ADHD actually have sleep-disturbed breathing. They don't sleep right.
Really?
The lack of sleep is why amphetamines work during the day. As an adult, if you don't sleep well, what do you do the next day? You drink 2 or 3 cups of coffee. It gets you going. One famous pediatrician, very well-known, highly respected pediatrician, once said of Ritalin, we've been far better off, I'm almost quoting, we have been all far better off we had just had our kids have a cup of coffee with us in the morning.
No kidding.
Because, if you don't get enough sleep at night, you're cranky. You're cranky the next day. It's harder for you to get your job done the next day. And we have compensated with stimulants. Now, what percentage of kids does the CDC say have airway issues? 20 to 30% of children have sleep-disturbed breathing. A lot of the sleep-disturbed breathing is because of large tonsils and adenoids. And what's one of the top drivers of large tonsils and adenoids? Guess what? Nutrition. Yeah. And there's a lot of preservatives in food, a lot of junk food that actually produces down. Now, Dr. Julie Way, who's very well known, she was the head of pediatric ear, nose, and throat at Orlando Children's Hospital, did a little pilot study where they removed junk food from the diet of a number of kids who were going to have surgery done and their tonsils and adenoids removed. Guess what? The vast majority did not need to have the surgery done if they got rid of the junk food. Wow. Sadly, we have people who make a lot of money off of junk food. Mm-hmm. So typically what I would do in my practice is we would tell people, try to remove the junk food, and we'd have them use a very safe, widely available nasal spray that has a little xylitol in it that gets rid of the inflammation and makes it easier for the child to breathe at night. Simple treatment. I cannot tell you how many times parents have come back saying, wow, everything's so much better. I raised 5 kids, and my middle son had to have his tonsils and adenoids removed because of airway issues. Changed his life, but he had to have it done. But most people, we could do simple things, and that's why we're here. We're here to talk about all this.
Mm-hmm. You mentioned a nasal spray. What was that nasal spray called?
I can't remember off the top of my head. No, actually, it's from Clear. It's a Utah company, it's here out of Salt Lake. It's American Fork.
Oh, okay.
Yeah. And they make a lot of xylitol products, and xylitol is actually a prebiotic. It's a naturally occurring sugar. Every time you eat a strawberry, that strawberry has 5 times more xylitol in it than it does vitamin C.
Cool. Yeah, and one thing I've learned about related to ADD and ADHD, I've been interested in it because before we had kids, my nephews were being diagnosed with it. They were giving Ritalin and then Adderall, and I just was like, really? You're going to give these kids something, the street equivalent of meth in a prescription drug, and think that that's going to solve the problem? And so we started learning about gut health.
Yes.
And we started to realize that my nephews who were getting basically diagnosed with ADD, ADHD, they're eating tons of processed foods,
yes,
tons of chips, tons of junk foods, sodas, and I'm like, this has got to have more to do with nutrition than the medical community is talking about.
But here's why. What amount of time does the average physician get of training in nutrition? It's less than 1 hour.
Really?
Less than 1 hour. And they all will admit it. They have no training or no understanding in nutrition. And they're bombarded, actually, by manufacturers who are sending them literature that is incorrect. And it is, every once in a while there's a really bad article that comes out, and the companies will send that bad misinformation to all the pediatricians. I work with a lot of pediatricians. Obviously, I work with pediatricians every day. And we are always trying to say, let's get back to a good diet. And, that's where the CDC came in again, releasing the information on the health and nutrition status of kids. And sadly, Utah came 8th from the bottom. And that was something that was really shocking, that so much soda, and yet that's a self-reporting study. So that is wrong, because self-reporting studies, having done actual diet studies where we looked at the diet of individuals, there are parents who report a fruit roll-up as an exposure to fruit, who actually think that a fruit roll-up is fruit and not really actually a candy. And they'll actually say, oh, yes, they get fruit every day. We put a little fruit roll-up in their lunch bag. I mean, it is very sad that people don't understand what real fruit or real vegetables are. They might even think that potato chips, that a potato is a vegetable, therefore I give my child a bag of potato chips. And sadly, that is true, that they're actually getting a vegetable. So The self-reporting
And that is true. A potato chip is a
yeah,
vegetable.
people
No,
think-
no, a potato chip is not a vegetable.
That's what people think.
Yeah.
That's what they're saying.
But it's not true, right?
I mean, it's not true, but they
Yeah,
think
it's
because a
starch,
child
it's-
has. So, what the study did not go into is exposure to carbohydrates, and the lack of exposure to protein. Kids need protein growing up. You need protein to make muscle. So these are some obvious things that I think most people know, but shockingly not everyone knows. And when I was doing a study, we looked at 30 kids that were very healthy from the northwest suburbs of Chicago, 30 kids from a blue zone, and blue zones are areas where everyone is far more healthy. There was a blue zone in Colombia, and 30 kids with autism. And we did a full analysis of all, it's called functional analysis, of all the proteins being produced and that were present in the saliva and by the microbiome. It's called metatranscriptomics, where you look at everything, and we use AI, artificial intelligence, to find what is different. Shockingly, and this has been done in a number of studies, you can diagnose autism with accuracy of 96% without even looking at the patient,
No kidding.
just by a sample of their saliva.
Wow. Because the microbiome is
The
what makes
microbiome
them
is different.
autistic.
Yeah, and the
Wow.
microbiome of all the kids that we had with autism contain bacteria that actually break down your neurotransmitters that are responsible for the development of the brain.
No kidding.
And
So are you saying autism is mostly nutrition based?
well, they have had studies where they have gone with probiotics and prebiotics and reversed many of the symptoms. As you know, a very famous study has been going on in Arizona State University by Dr. James Adams and others, where they've been doing fecal matter transplants.
Yeah, I've heard about them.
Yeah, and they've had, their results are incredible
Mm-hmm.
at reversing autism, all the signs and symptoms. Of our 30 kids, we had them on a prebiotic, which is a xylitol, and a probiotic for 60 days. Actually, we did 60 days of the prebiotic and 60 days of the probiotic. And 9 that were nonverbal became verbal. It was a shocking response that we did not expect. But in the literature, since we did that study, there have been multiple other studies published in top journals, you know, Frontiers and Neuroscience and so on, top journals, where they've had the same result. So yes, it's a tree.
Why isn't this making big headlines?
Well, it is, and like I presented this at the Society for Neuroscience meeting. So in the researchers,
I have not seen anything about this in
it's
mainstream
not
media,
making
local
it
media.
into the lay media at all.
I can probably guess why.
It's really interesting.
I mean, this goes totally against the status quo. The status quo
Yeah,
is
yeah.
drugs can produce
drugs.
the best outcomes.
Yeah,
more
yeah,
drugs.
And
more drugs,
more
and-
prescription drugs. Not
And then you have the side effects from the drugs, like you mentioned before, Ritalin and Adderall, Concerta. You know, these poor teenagers who get like the Concerta, it rots their mouth. It looks like meth mouth. It's horrible what it does. And every time we bring that up to a parent and saying, "Hey, your son, I'm sorry, his mouth is rotten now. I mean, severe periodontal disease, lots of caries. It's a side effect.
it's meth.
Yeah,
It's the same
like meth. And they were so shocked that the pediatrician never warned them.
Mm-hmm.
You know, I had no idea this was going to happen.
And you know, I go around. I've been stuck on this project where I go around interviewing homeless people and getting their input into our homeless industrial complex, we call it. And so many of them tell me they use meth because they're self-medicating, because they were diagnosed with ADD, and this is really the way they get their fix. And so when somebody believes they have ADD and ADHD and the only thing that's going to help them is a stimulant, and they go through life that way, that's got to be such a handicapped.
It's got to be
It's
so
gotta be-
addictive. It's got to be so addictive. You know, nicotine is so incredibly addictive, and there are so many things that you can become addicted to. And I'm not surprised. It makes total sense to me.
We're creating a society of people dependent upon
Meth.
chemical meth stimulants at a very, very young age. And then we're taking them through and trying to tell them, this will help you concentrate, this will help you focus. And I'm not saying that's not sometimes a good solution. I've talked to some parents who say their kid was absolutely unable to study without it, and then when they got on it,
What were the parents? Did you ask the parents what the kid's diet was?
Yeah, that's
They probably said Frito-Lay and
Yeah,
Pepsi.
yeah.
Yeah,
I mean,
but
I've had
it's-
parents tell me we almost never have any candy per se. I mean, at most, little Patricia will have a candy bar maybe twice a day. You just go like, whoa, no, that's not the way you're
Or
supposed to eat.
they only get their snack pack and Fritos and their candy with their lunch.
And then
Everything
they
else
sneak
is great.
more too at schools. They get more.
Yeah.
They sneak
Well, that's
in
the problem
schools.
with our kids. We feed them really well at home,
Mm-hmm.
but they have total junk food at school.
Yeah, their teachers
And-
give them candy.
Yeah,
as
they give them
reward.
candy all the time,
Yeah,
and
that's
then I
like the
come back and
workplace.
I have a bag of candy. I'm just gonna eat it.
See, I
I'm
actually
hungry
went in
for
and
dinner.
gave, because I have access to lots of gum, xylitol gum, good gum, and I actually went into the school where my daughters go, and I gave their teachers cases of gum, and I said, when you're giving candy out, give gum.
Yeah,
A good gum.
I don't like gum. I can't
Yeah.
stand it when my kids are chewing gum.
Yeah, the gum
this
sometimes.
This is actually gum that fights tooth decay.
Okay.
It's actually
And gum
maybe
disease.
maybe I could live with that.
Yeah,
Yeah.
it has a lot of good positive things because, again, this is something that going back to, nutrition during COVID and the lockdowns, nutrition went down the tubes.
Yeah.
And we know that because there's been studies. There's some great studies that came out of Japan, for instance, where they looked at it very carefully at Japanese school kids, and the food was so much worse during the lockdowns. During the lockdowns, the number of kids going to the hospital with dental emergencies like abscessed teeth and gum infections increased significantly. I mean, it was a 50% increase.
Yeah.
And, whenever some child has to be treated in the hospital, the cost is thousands and thousands of dollars. And after the lockdown, it still was up over 25% because of an inability to catch up with all the things that didn't happen.
Well, I think we're still seeing the fallout from the psychological well-being of people.
Yes.
Like our homeless population in Salt Lake has doubled over the last 2.5, 3 years, and we're basically just seeing these people who are experiencing a mental breakdown, and they're unable to really function. And a lot of them are just walking the streets, trying to figure out where they're supposed to go, what to do, and you can see like there's a lot of compassion, but they're not well nourished at all. Most
No.
of them are drug dependent.
Yes.
Most of them aren't getting any treatment. We're providing housing now, but what we're finding out is the housing is only solving that problem. The neighborhoods around the housing units are completely deteriorating because they're going out and using drugs, and they're doing sex trafficking, and so it's this big societal problem. And I think it all comes back to nutrition, because if your body's not receiving proper nutrition, that's your brain chemistry is made in your gut. A lot of people don't get that.
Yeah, the neurotransmitters, the chemicals for the brain are made in the gut. And did you notice that just yesterday they also came out saying another big increase in the rate of autism?
Really.
Even with less diagnosis being done, because a lot of the schools were closed during that period of time, the rate went up significantly again. And again, with the work we have with autism and other type of issues, psychological issues, in Europe they have a completely different tack. They've gone in, they have done a lot of things where they do microbiome transplants. And to make the microbiome transplant work, they actually changed the diet. In Europe, 8 countries in Europe got together and they randomly assigned nursing homes to a good diet or the regular commercial diet that they had. The ones that had the good diet, the elderly did so much better. A lot of their symptoms went away. They were able to walk better. And funny enough, it costs less money. So one of the reasons we're here in Utah, we have that meeting next week called the Golden Spike meeting. We're here also to talk to the legislators, and we're doing this, we're making a big push to try to get us so we can do in the schools, start in the schools, and also prenatal care. That is so vitally important to get good nutrition in there and also good preventive care. Nate mentioned the gum. He offered to sell at cost to the schools to to get them going, because chewing that xylitol gum reduces the cavities, reduces the abscesses. Just 3 years ago, they did a study that they published in JAMA, Journal of American Medical Association, in pediatrics, where they followed people up to 27 years. And they found that the kids who had the dental infections, the oral problems, were the first ones to get cardiovascular disease, atherosclerosis, and everything else.
Wow.
We all know there's over 7,600 published articles now in the medical literature. Over 7,600 published articles showing a direct connection between gum disease and heart disease.
Wow.
And yet we know it increased by 50% during the COVID lockdowns. At least the data from Japan. We're probably about the same. We didn't do anything to prevent that. That is my biggest pet peeve. When they came out and they had their guidelines during the lockdown for what dentistry should be doing, it had things that people couldn't do themselves. Like they were saying, sealants, fluoride treatments. But the dental offices are closed. How is that going to happen? It's not going to happen.
But there's no money in preventative care. What sort of legislative body is going to say, we, instead of giving all these breaks to drug companies and mandating everyone get vaccinated, let's do preventative care? What legislative body is ever going to say that?
The states can do it. And I tell you right now, we're going to have the state of Utah lead the way.
That would be great.
That is what we want to do.
And I gotta enter.
Yep.
So, I mean, this is such a. It gives me so much. I don't want to say anger, but angst,
Frustration.
because the whole concept of public health using pharmaceuticals. I mean, and this is my humble opinion, but I think that the Surgeon General and I think that the CDC should be banned from even mentioning pharmaceuticals. Their job should be Centers for Disease Control and Prevention. It should be based on hygiene, it should be based on nutrition, and it should be based on exercise.
Yeah.
Because if they can spend as much money as they're spending trying to get everybody with this gene therapy jab, whatever, whether you want to get it or not, the money that they're spending on that, they could have over the last 3 years completely changed the way Americans look at fitness, the way they look at diet. I mean, the amount of money that they've spent, it's ridiculous. It's absurd. And our Surgeon General and the director of the CDC, if they had stood up in early 2020, mid-2020, when the studies came out of Israel, where they showed that people that had periodontal disease, they were 8 times more likely to be hospitalized and die from COVID than people that didn't have periodontal disease. That's a simple thing.
No kidding.
All they had to do was come out and say, hey, people, look at this. People were afraid. They were terrified. And if they'd come out and said, hey, you're 8 times less likely to be hospitalized if you brush your teeth a little more often, eat a little less
But
sugar.
the problem, I
and
think,
they wouldn't do it.
is you have this dominant corporate media, and that whole complex is driven by drug companies. Look at the commercials you see.
And I
We understand
and
that.
CBS
Yeah,
News.
we-
And hang on, and I
It's-
100% understand that. But if the director of the CDC and the Surgeon General had stood up and said something, I think the media would have said something also.
But
they
the director
didn't.
of the CDC is getting paid off too.
I don't disagree. I don't have any proof of it, but I am 100% not going to agree. I think there's people at our state level. I mean, going back in early 2020, and this goes back to our nasal spray and COVID, but in early 2020, we had some studies come out where we showed that utilizing some of the ingredients in our nasal spray destroyed this virus in the airway. We offered to give, I can't remember if it was 10,000 or 100,000 bottles to the state. And the state just said, no, it's not a drug. We're not going to look at it.
Yeah.
We actually sent studies to Angela Dunn, and she said, is it a drug? Is it approved by the FDA? If it's not approved by the FDA, they're not going to look at it. Okay?
Yeah.
But there's so much research, and you can speak to it, but there's so much research showing that simple washing your nose out, they did studies, and we had some of these studies again in early 2020 that came out of, like Vanderbilt, that came out of the University Medical College of Georgia. Some of the stuff that came out of Utah State University that showed that if you addressed it in the nose, that it was over. Like in all of the studies that I'm aware of that were done with nasal sprays, not a single person was ever hospitalized from COVID. Not a single one.
So address it in the nose. You mean take
Correct.
a nasal spray right
Yeah.
when you start to feel the
Yeah.
effects? And
Yeah, it was shown to reduce the infectivity quite a bit. And again, a simple solution. It's like now they're talking about the nasal vaccines. And I was at a meeting in Europe a year and a half ago, 2 years ago, where they showed the nasal vaccine as being superior to the vaccine we were using. But again, no one went with it. Now everyone knows that's a better vaccine to treat where the infection begins. You have this vaccine you give up the nose. But no, it's been a problem.
But it just doesn't seem
hoping.
like that's getting out. And I hope we don't face any more YouTube slaps for talking about it, because that's where we've been penalized on YouTube before. But I mean, you guys you're a medical doctor. You play one on TV.
No, I don't play one on TV. But when it comes to nasal hygiene, I think I understand it as well as I think I have a much better understanding.
I think it's sad that
than most people.
if you bring up alternative therapy, like I just thinking about Joe Rogan talking about ivermectin, and then CNN says Joe Rogan using a horse dewormer, and ivermectin is one of the most commonly used it's an parasite
Yeah.
all over the world. It's got the guy who came up with it got a Nobel Peace Prize, and they're just
Nobel
saying
Prize in medicine. Yes.
and he's using a horse dewormer, the same thing, like he's some kind of redneck idiot. And it's just unbelievable that any alternative therapy is getting labeled that way.
I thought one of the best ones he did was Sanjay Gupta. That isn't what we were talking about. Well, maybe.
Yeah, it's unbelievable to watch how it's happened.
Well, I think right now that we have an opportunity to go forward. And I really want in Utah for us to have the first state, Utah be the first state to go forward and put forth in the schools and also in prenatal programs, preventive program, show it works. It works on a statewide level. If Utah will do it and it works, and the key thing is if it saves the state money, which it will do.
We've already shown that. I mean,
that's well demonstrated.
So let me explain this, because this is a part of what he's talking about, is that there's studies out there that show that if you use xylitol chewing gum that's 100% xylitol and you have kids chew it for 2 years, you change the microbiome of bacteria in their mouth and you have lasting protection. Okay?
So you're actually changing the biome of the bacteria in their mouth.
You're inhibiting the pathogens. Mm-hmm. Now, the thing about xylitol is humans, rats, and mice all metabolize xylitol very well. There's research going way back why that is the case. And bad bacteria cannot. Tumor cells cannot. Cancer cells cannot metabolize xylitol, but the rest of your cells can. That's why xylitol IV has been used intravenously for sepsis. And it is very interesting that even though they know this at the medical centers, if you have a child with cystic fibrosis, you give them a xylitol nebulizer so they don't get infections in their lungs. Show them be very, very safe and used for a long time. The biggest problem with xylitol is you can't patent it.
Yeah, exactly.
It's a naturally occurring sugar that is present in many foods. The human body produces about 12 to 15 grams a day in the liver. Your cells uptake it through what they call the glucose transport pore, which is the same way your sugar goes in, and is utilized by your mitochondria, which has all been known since the 1960s.
Yeah.
And so it's a good energy source for your regular cells. And good bacteria don't really mind it. The pathogens don't like it. The bad bacteria, they can't stick to your cells. They can't penetrate into your cells, the bad bacteria. And they don't do well around xylitol. So over a period of time, yes, you do have a very beneficial effect on the oral and the mouth and that set of bacteria. And the nasal, which is another story altogether. But in over half the population, the mouth sets up the gut. So if you have a mouth full of bad bacteria, you swallow up to 1,000 times a day, up to a liter of saliva a day, you swallow 100 billion bacteria a day. Mm-hmm. And if they're the bad guys, guess what? Eventually they'll take over your gut. They'll take over your small intestine, and before you know it, you have all these gastric issues. There's no doubt about this. It is very well published now. Many journals back that up with good studies. So when will we get people to understand? At the lips, that's when your gut begins. And if you can get the xylitol going well in your mouth and get rid of the bad bacteria, you're going to be a healthier person. But you have to have a good diet too.
Yeah.
You got to feed them. You know, if you don't feed the good bacteria, they're not going to survive.
You know what's interesting? So my middle kid has behavioral problems, and he was put in a behavioral program. And we walk in and we see this like smorgasbord of like muffins and candy and chips, and I'm like, this is a behavioral program and you're feeding this, and they're like, no, this is all nutritious, these are made with whole grains, these muffins. And I said, but they're all sugar and fat. And I said, do you know about the literature concerning gut health? And oh yeah, that's so good, you know about that. I was like, yeah, your brain chemistry is made in your gut. So why aren't you guys feeding the guts of these kids with behavioral problems better food? And she's like, oh, that's such a good point. That's such a good idea. But this is all very healthy food. I'm like, no, it isn't.
No, it's not. I know.
Don't try to.
I love it. It's just full of sugar.
Yeah, it's all processed. All of it.
If you look how many grams of sugar and a lot of that processed food. But there's been, by the way, there's a preservative that's in a lot of those foods that has been directly linked to autism. And that preservative, you can show in all the animal studies, when they give that preservative to dogs, when they give it to pigs, when they give it to primates, if they give it to rats, they all develop autistic symptoms.
No kidding.
And yet it still is allowed.
Wow. Because people are making money on it.
Calcium propionate, if I'm correct.
Yeah.
Yeah.
So I tell parents, look for calcium propionate. Don't buy any product with calcium propionate. I've had a lot of parents come back to me saying, you know, she's doing so much better now. We watch the label. As far as I'm concerned, it should be off the market. In fact, good bakeries actually will tell you they don't use it. In Chicago, there's a very well-known Italian bread, big manufacturer. I called them up and said, you don't use calcium propionate, do you? And they go, oh, absolutely not. Not since the Australia studies coming out showing behavioral issues with kids when you use it in bread.
Really?
So
calcium propanol. So you need to
propionate.
look
Calcium propionate. Yeah.
So you got to look for that on the label when you buy bread.
Yeah.
So what other recommendations would you have for especially kids who are maybe looking obese or parents who want to get more interested in nutrition?
They're looking at obesity. You have a couple of reasons why. Sadly enough, going back to airway is in fact, if you have a kid with airway issues, you can actually safely predict when they're going to gain the weight. There's beautifully published research on that. Okay, that's one. But airway is also related to large tonsils and adenoids. That's also diet related. So the very same foods high in sugar and preservatives that are causing the large or adenoidal tissue will also be the ones that actually cause you to gain more weight. Now, the mouth breathing changes the oral microbiome, which then changes the gut microbiome. So you have a package deal. And it's like coming here and getting a flight, a hotel, and ski tickets and a ski rental all at one package deal. If you have the bad diet that creates all this to begin with, it cascades through weight gain, and then, of course, you get the bacteria that are bad that actually can lead to more diabetes and pre-diabetes. They cause insulin resistance.
Yeah. Do you get into specific foods that can control that can help control a kid's maybe hyperactive eating or disorders or things like that? Or
you know, it's funny. I mentioned those 30 healthy kids, and they were very healthy. Every parent had a rule. We called them the whole food kids because they ate non-GMO. Everything was kind of made at home. They bought fresh food, grass-fed beef, pasture-raised chickens. They bought the good food, but at the end of the day, their costs were less because they had far fewer medical needs.
Yeah, that's the thing about our whole healthcare, medical care. It's we have a sick care system, not a healthcare system.
Right.
If we actually had a healthcare system in place, it would be all focused on preventative.
Correct.
And getting people on better diets to prevent
Yeah.
problems.
This
It's
goes
like-
back. I didn't even get to it. I went off on a tangent earlier, but this goes back to implementing a chewing gum program in the school. We forgot to mention that. I actually went to the state of Utah Department of Public Health. I went to Utah County because I live in Utah County, to their public health, because of changing buying patterns during COVID. We had about $750,000 worth of gum that's packaged in little things you sell at the check register, and people weren't standing in the check stand buying stuff. So we had all this gum, and we threw it out. Before we threw it out, we went up to the Utah Department of Health and said, hey, look at all these studies with xylitol. They knew what xylitol was. They knew that if you use it, you pretty much end tooth decay in kids. I mean, it's not 100%, but it's close, is it not?
Yeah, it's a very excellent way of.
I don't know much about xylitol.
Not only that, but it also reduces
gum
upper
disease.
respiratory infections by 42%. So think of the money that you're saving if you stop tooth decay and you're reducing upper respiratory infections by 42%. We tried to give the gum to the state. They wouldn't take it. We went to the place down in Utah County, and we offered to give them the gum. And they were sitting there telling us stories of how horrible some of these kids are, that their teeth are so bad that they can't think straight while they're in school. Yet they're afraid to go and talk to people because they know that their parents don't have enough money to pay the dentist.
Yeah.
Which most dentists are compassionate enough that if someone brought in a small kid that had teeth like that was suffering like that, the dentist would probably help them as much as they could, free, if not somehow figuring out a different way to pay for it. You'd have to be inhuman to just turn away a child like that. But we offered to give this stuff to him for free.
Wow.
Not even a single place we could do it. We dumped it in the dumpster.
Wow.
Okay?
I have to go back to.
Well, hang on.
one
Let me
of the-
finish
yeah.
this one thing. We actually were trying to get the state to implement gum chewing programs because the cost that it would be to do these is $25 a year per child.
But what if you get a parent who doesn't like gum? I can't stand when my
If
kids
you
are
can,
chewing gum.
well, no, but you're chewing it for 5-10 minutes
Yeah,
in the
and spitting
morning
it out,
and
yeah.
spitting it out. You come in
Problem
from
is,
school.
like, they got to spit it out in the right place.
Well, and the thing is that they've actually done studies looking at this. But if you have these programs, when kids come into school in the morning, you give them gum as they come to the classroom. They chew it. They do the attendance, whatever. 10 minutes later, someone walks around with a trash can. They spit it out.
Yeah, that's okay.
And
Yeah, could
I
do
also
that.
want to point out this, that even if they don't, let's say they stick it under their desk, pay the janitor a couple extra grand, $5,000 extra grand a year, you're still going to be hundreds of thousands of dollars ahead than if you didn't do it.
Yeah.
But yet we can't get our state, we can't get our public health to even look at it.
Another thing we've looked at in this program in the past is, so there's all these farmers all over Utah that have excess crop production, and they end up wasting it.
Yeah.
There's an idea called a food hub where you could actually bring all your excess food and get paid for it as a farmer to a place where they could process it and then distribute it to public schools. But the state legislature doesn't want to put forward the money to actually get that off the ground. IHC has a grant just sitting there. I think it's a $3 million grant to help get it off the ground, but it would enable all farmers in all of Utah, all over Utah, to just basically give their food, their excess supply, to people picking it up, and then they'd process it, and it would go directly to kids' lunch programs. Because in the lunch programs right now, you got corn dogs, hot dogs, pizza.
Oh, that's really good
and the
food.
kids, yeah, they'll
just
eat
yummy.
that, and they love it, but they're not getting any fresh fruits and
Come
vegetables.
on,
It's
pizza.
all
You got your
processed
grains, you
frozen
got your
stuff.
meat, you got your veggies, you got your dairy.
tomato sauce. You're getting the vegetables and the tomato sauce.
Yeah, that's exactly what people think.
But I have to go back to, so I kind of fact check myself on the fly. I hate it when I misspeak. I heard what led me to say, did Fauci receive royalty payments from the drug companies? Was I heard Rand Paul grilling Fauci, but you received royalty payments, didn't you? And he kind of deflected it, didn't answer it. I've got the story up on my page right now from National Review. Did Fauci and Collins receive royalty payments from drug companies? The NIH is not opening the books enough to confirm or dispel that idea. But lots of directors got payments, royalty payments from drug companies. They know that. They don't know the specifics of who got how much. So we know our politicians are getting money from these drug companies.
Hang on.
Even our CDC.
I want to clarify this.
Yeah.
These guys are not politicians.
Yeah, they're not.
They're not. They're bureaucrats.
Yeah, they're bureaucrats who are unelected, making the decisions for our public health.
I want to clarify this because over the last couple of years, I've spent a lot of time in Washington, D.C. Okay? And I think that both sides of the aisle in D.C. are pissed at the bureaucrats in the executive branch.
Yeah.
I mean,
the deep
Ron
state.
Johnson, you see this. He actually held up and he goes, I'm asking questions to the FDA, and they give me a page with blank lines across it. They redacted the whole thing and sent me an email that's totally redacted. That's all I get. You know, we have an issue going on with our government, and it's like trying to pull teeth out of someone to get any answer out of there.
Yeah. And they're so hush-hush. And because they're not directly accountable to voters, they're just
they're not accountable to anybody.
We can redact the whole thing. We don't need to give you squat. You don't.
Yeah.
Because they're not elected. They're not accountable.
And going back to that, I think it should be, if it's not illegal, it's immoral for government bureaucrats that are in the position that any of the bureaucrats are in to mandate a vaccine, to mandate any product.
Yeah.
Or even to promote a product. They should not be getting royalty payments on any of those.
No.
That is criminal. If not criminal, it's immoral.
Yeah.
It would actually be illegal for a physician, because of the Sunshine Act and everything else, to be up there promoting a drug or a procedure and get money and not report that. It's illegal.
But bureaucrats can do it.
But they
But
can
bureaucrats
do it.
can do it.
Like every year
Yeah.
to Northwestern University, I have to show my 1099s, explain why I got paid by certain people and for what.
But you guys are talking about promoting the idea of changing national health to make it preventative.
Yes.
And we know the people who are in charge of the CDC, the NIH, whatever, they're getting
want drugs.
payments.
They want drugs.
They're getting royalties. That should be absolutely illegal. That's where you'd have to start, right?
I want to go back because this is actually one of my favorite topics because I've been in the middle of this fight for a couple of months, for 3 years now.
Yeah.
But if you go back through history, in the whole of human history, we've had epidemics and we've had pandemics going on forever. I mean, there's a book out there, and I think I've told you about it, called Epidemic Century, and it chronicles that over the last 100 years in the United States, since the Spanish flu, and even one before the Spanish flu, up until today, every 10 years we have an epidemic or a pandemic of some nature. Well, if you look back at all of those, just think of it. How many of those were ever solved by a vaccine? 0. How many of them were ever solved by a pharmaceutical product? 0.
Really? Smallpox?
No, the smallpox wasn't an epidemic. It wasn't a pandemic.
It was endemic.
It was endemic.
Endemic.
It was around forever. Smallpox goes way back. In fact,
And the
there
Spanish
was Egyptian
flu,
mummies.
they were
That was a
comparing-
pandemic.
that was a pandemic
So you
that
have
was never solved,
so something
never
that's
cured.
endemic, just it's there and it's constant.
It's like tuberculosis.
An epidemic is
Okay.
it goes up like this in a local region. A pandemic it goes up all around the world.
Yeah, yeah.
The only one where you can make an argument would actually be polio. But they didn't start vaccinating polio people until after the pandemic part of it was
I
over.
heard that.
Yep.
Yeah, my wife just read that.
Yeah.
Yeah.
So I think it is absolutely absurd. But let me finish this. Every single one of these epidemics or pandemics was solved by a hygiene or a sanitation solution.
Really?
Yes. But not a single. Our government leaders, our public health officials, even the ones here in the state. You know, again, we sent all this research to Angela Dunn. She refused to look at it. She said, it's not a drug, it's not FDA approved. Don't talk to me.
I couldn't believe it when I had been tested for COVID a few times, and I swear I had it twice before. The third time I finally went to IHC, said, give me the real accurate test. And then they said, yeah, you got COVID. And I said, okay, I really, I'm not, I'll just say it, I'm not getting vaccinated. I'm not an anti-vaxxer. I think it's great for some people, but it's not for me. Could I get some ivermectin? And she laughed at me. That doctor, she's just like, are you kidding me? You're one of those people? And I'm like, it's an anti-parasitical drug. They're using it in every single country effectively all over the world. You obviously don't know this because you're not reading the news accurately, but it's an effective treatment. And she just said, just go. And she was so rude to me. She was it was a doctor, and do you guys?
I don't
mean,
think that healthcare is going. I don't think it's going to recover from this as we know it, because the public health and healthcare in general, I think that it has got such a black eye. I don't think it can recover. I don't think it can.
What do you think?
And right now, we have a process in healthcare where everything's becoming big corporate.
Yeah.
All hospitals
And people are losing
merging.
faith. I mean, that's another major institution. People are really losing their faith.
Even now, veterinarian offices are all being bought up by big corporate. So, and the model is to, it's a financial model, not a model based on, care. So that's a whole nother issue.
Yeah.
That's a whole nother issue. So there are people responding to it. There's a lot of concierge medicine physicians. But the head of one of the big concierge medicine groups, and these are little small private offices where you have 24/7 access to your physician, and the physicians practice preventive care. They showed that in just one group of them, they saved Medicare $340 million in 1 year. In cost because they're practicing preventive care. But
how can that model, though, gain a foothold when insurance companies and pharmaceutical companies
there's the problem.
Yeah, because I think that is the model. I mean, as a company, we're offering healthcare. And I'm like, yeah, here it is. But it doesn't cover hardly anything, and your deductible is so high, and you actually pay way more if you go to the doctor with insurance now than if you say, hey, I just want to check up. What kind of deal can you give me?
Yeah,
and
the costs
so,
have gone up so much.
Wait,
all levels.
who goes to the doctor to ask just for a checkup anymore?
I don't know.
I'd have to be in a casket before I'd go to the hospital at this point.
I wanted to get blood work. I think that's probably important to get done.
There was a study just came out.
You go to a hospital to die.
Doctor.
There was a study just came out from a large dental group. And they have about 1,000 offices. And they started routinely just doing the hemoglobin A1Cs on their patients coming in. And they found about 30-some-odd% of the adults had coming in were either diabetic or pre-diabetic. They didn't know it.
Wow.
It's a huge number. And that is diet-driven for the most part and microbiome-driven. And a lot of them hadn't seen their physician in 2 or 3 years. I haven't gone in because I'm not sick, and I'm not going to do any well checks because I come in and I get sick after they see me because they want to give me all these drugs.
I see a naturopath 5 years ago. That was a good experience, but seeing a traditional doctor, I was like really disappointed. They're just have a narrative and they have an agenda, and it does not feel like their agenda is health care. It's sick care.
Yeah, you're right. But there are integrative physicians, and there are people who believe in integrative medicine.
I think naturopathic movement is good. Do you like that idea? Or
I just think when people come out of medical school, they should go ahead and maybe go to Arizona and get an extra residency done in integrative medicine, and then get the whole feel. Because right now medicine is so divided. Everyone has their own little specialty, and they don't even bother looking outside that specialty. I could give you many examples where a patient has a syndrome but it's missed. I mean, there's something that's treatable, but it's completely missed because they see a specialist who only looks at one part of the body, and they miss the whole rest of the package because they don't even bother to look.
Yeah, I agree.
Yeah.
Yeah, well, thank you so much, guys, for coming on.
You are so welcome.
What you're doing is great. It's I think that the way we raise our children, the nutrition we give them, the food we feed them, of course, that's going to carry on to later in life. And I think more parents just really need to examine and understand, you are feeding your brain chemistry.
Yes.
And these disorders that they say kids have, I believe they're treatable through preventative care and nutrition, and not enough people are really looking at it that way. So I'm glad you guys are doing that.
We're doing our best. That's why you have our meeting here next week.
Tell everybody in Utah, everybody here in Utah, contact your representatives and your state senators and tell them to look at implementing health programs, prevention programs in the schools.
Yeah.
Again, for $25 a year per kid. Which, how much does it cost to fix a cavity in a kid these days?
Yeah, I mean, it saves so much. But it's not just fixing the cavity. I mentioned before about the infection, the pain, and down the road, the cardiovascular disease. I mean, you're talking about years lived. And it's such a rampant problem. It is a huge rampant problem. And it went up a lot during COVID.
Yeah,
There's a lot more kids having a lot more problems, and they're going to pay for it all their lives.
And you can
preventing
stop
it. We could stop it.
for $25 a year.
Yeah,
We've already done the numbers. We presented it. We gave it to the state.
yeah.
And I was, in fact, Gus was on there with me because he happened to be in town, and it's another doctor. But
So you're talking about the gum in
the school.
class.
And we were talking to some, I mean, bless her soul, but she was like 26, 27. And she said something along the lines of, she's talking to two of us that are in our 50s, both of us having been working for, 25, 30 years. And she goes, well, in my vast experience, I don't think that we want to implement any prevention programs. What we really want to do is get equal access to care, and we're going to spend more money getting dentists in there to visit with these kids. And I'm just like, you got to be kidding me. I agree that that the kids need to see the dentist, but there's a lot of them that can't. And you can spend $10,000 and get 5 kids, no, more than 5, and get, so many in there. But if you implement gum chewing programs for that same amount of money, you could probably get all the kids in Utah chewing gums, cutting down on tooth decay, cutting down on respiratory infections.
They'll also cut down on the sugary snacks. That's the main thing. It wasn't just gum. In the future, we're looking at other types.
Well, I
of
think
things.
gum is one maybe piece. I don't know.
It comes
But I
as
think
more
it's
than
just
one piece.
it's just got to
It's two
be.
gums, yeah.
I think parents to say that the schools have to do this. I think parents just have to become much more involved. Like we really had to become involved to be able to say to the teachers, look, we don't want our kids being fed all these sweets. They're giving them candy all day. Please just stop doing that with our kids. I know they'll feel bad. So we actually gave
cookies.
We gave the front desk applesauce for our daughter because she was watching all the other kids get the treats, and she gets applesauce because we just know it's terrible. It's just like gonna mess up.
And I have a nephew. I'm sorry, who's special needs. He's in a group home. He calls me every day. I talk to him, and every day he tells me they keep trying to feed him waffles with syrup for breakfast, and he's a diabetic.
Gosh, yeah. It's just this amazing amount of malnutrition going in schools.
I'm not supposed to give my kids waffles for brekkie?
If
Corn
they're
dogs and
diabetic,
waffles.
No, they get sausage and waffles that are actually mostly eggs.
Yeah.
Yeah.
There's a little bit of flour mix in there, so it cooks like a waffle. But
Yeah. Well, thanks for coming on, guys.
Yeah,
really
thank you
appreciate
so
it.
much.
Yeah, good
Yeah.
luck with your conference. And
Okay.
where your website is what again?
well, it's AOSH.org.
AOSH.org.
AAOSH, American Academy for Oral and Systemic Health.
All right.
.org.
Great. Okay.
hey, wait,
Thank
I got
you
to
so
tell.
much.
And our webpage
Oh,
is
yeah, your webpage.
Clear, XLEAR. If you want to read the .com, and if you want to read all of the studies behind it, go to clear.com, xlear.com/science. And I mean, there's tons of studies on
Yeah,
there.
we'll check it out.
So
Sounds good.
Thank you
Okay,
so much.
Nate, Mark, thanks a lot. All right, thanks for joining us. And if you want to be a bigger part of Utah Stories, go join our free digital newsletter. It's at utahstories.com. And we will send you the voice of local Utah absolutely free to your inbox once a week. We don't spam you. If you don't open it, we automatically unsubscribe you. And it's a great way to get in touch with the local community and the voices of people who should be heard. That's right here on our website on this sidebar. And go fill that out. And if you want to be a subscriber to Utah Stories Magazine, $36 for the entire year, and we'll send it right to your door. Thanks for watching. See you next time.